All right, today we're jumping right into the deep end, the high-stakes world of clinical neurology. I've got two case files for you, two real medical mysteries. And for these patients, getting the right diagnosis, the right treatment, well, it changes everything. And the best part? You're going to be in the driver's seat for this one.
That's right. For the next few minutes, I want you to be the doctor. You'll see the symptoms, you'll get the lab results, and you'll have to make the tough calls. It's all on you. So you're going to get the exact same information the doctors had. The question is, can you solve these two very different neurological puzzles? All right, let's get into it.
Okay, case file number 1. Our first patient is right in the middle of a serious crisis. I want you to picture it like a sudden, violent storm just exploding inside their nervous system.
So, here's the situation. We've got a 35-year-old man, and for the last 3 weeks, things have been going downhill. He's got these recurring headaches, he's confused, his vision is doubling up, and his right arm and leg are feeling weak. Now, here's a huge piece of the puzzle. He has a history of Behçet's disease. That's a big red flag, right? It tells us his body already has a tendency to get inflamed. That is a major, major clue.
And sure enough, when we examine him, that right-sided weakness is definitely there. So we know the problem is neurological. But to really figure out what's going on, well, we've got to look inside his head.
And wow, the test results, they are not subtle. The brain MRI lights up with these bright white spots. We call them T2 hyperintensities, and they're basically screaming inflammation and damage in some really critical parts of the brain. Then we do a spinal tap, and it's the same story. His spinal fluid is just packed with inflammatory cells and extra protein. No doubt about it, his central nervous system is under a massive attack.
Okay, doctor, back to you. The evidence is overwhelming. This is an acute inflammatory crisis. What you do right now is absolutely critical. So what's the play? Do you go for a long-term drug like methotrexate? Do you hit this thing hard and fast with a big dose of corticosteroids? Or hey, maybe it's an infection. Should we start antibiotics? The options are on the screen. What's your call?
All right, if you went with B, high-dose corticosteroids, you nailed it. That's exactly the right call. When you're facing a fire like this, the #1 priority is to put it out, to shut down that inflammation as fast and as hard as you possibly can.
So what we're looking at here is a flare-up of something called Behçet's disease. It's basically his own immune system going rogue and attacking his brain and spinal cord. And when that happens, you need the big guns to stop that attack in its tracks. And that's exactly what corticosteroids are for.
And this whole case really hammers home a key principle in medicine. You've got to pick the right tool for the right job. Think of it this way. You have emergency tools and you have maintenance tools. The corticosteroids, that's your fire extinguisher. It's for putting out a raging fire right now. The other drugs like methotrexate, that's more like your sprinkler system. It's for long-term prevention. Trying to use a maintenance drug in a crisis is, well, it's like trying to fight a house fire with a spray bottle. It's just not going to work.
All right, let's switch gears completely. Case file number 2 is a totally different beast. We're not dealing with a sudden storm this time. Nope. This time, we're more like detectives, looking for a pattern of clues that's been hiding in plain sight for a patient's entire life.
So our patient is a 16-year-old kid. He's not in any immediate danger, but the clues to his diagnosis have literally been written on his skin since he was a baby. We're talking multiple light brown spots, some freckling in his armpits, a couple of small, soft lumps on his arm. An eye doctor even found a telltale spot on his iris. You know, any one of these things on its own might not mean much, but when you put them all together, it creates a classic pattern. A genetic test confirms what we suspect. It's neurofibromatosis type 1, or NF1. So, we have the diagnosis. Check. But that leads to a totally different kind of question. This isn't about putting out a fire. This is about preventing one. It's all about proactive management. So what's the absolute best next step for this patient? Should we schedule an annual eye exam? Get a brain MRI right away? How about a neuropsych assessment? What's the top priority here?
And the correct answer is A, the annual ophthalmologic examination. Now, don't get me wrong, all those other things are important too, but the eye exam is priority #1 for preventing a really serious and permanent problem. Let me show you why.
So, why the eyes? What's the big deal? Well, NF1 is a genetic disorder that causes tumors to grow on nerve tissue. They can pop up anywhere. And yeah, the little lumps on the skin are the most obvious part, but it's the tumors you can't see that we worry about the most. Specifically, there's a risk of tumors growing on the optic nerve, the one that connects the eye to the brain. And that is why this is so critical.
These specific tumors, called optic pathway gliomas, can grow silently in kids and teens with NF1. If you don't catch them early with regular screening, they can cause permanent vision loss. So this isn't about treatment, it's about surveillance. It's about being vigilant and staying one step ahead of the disease.
Okay, so let's just pause for a second. We've just walked through two completely different neurological cases. One was this explosive, immediate crisis. The other was a long-term condition that needs careful watching. Let's pull back and think about what these two stories really teach us about how a doctor needs to think.
And here it is, the core lesson. Case number 1, the storm, was all about urgent intervention. The question was, what do I need to do right this second to save this person's brain? But case number 2, the pattern, was about proactive surveillance. The question there was, what do I need to watch for over the long haul to prevent something bad from happening? See the difference? Both are absolutely vital skills in medicine, but they are totally different ways of thinking. It really comes down to knowing, am I fighting a fire or am I installing a smoke detector?
So when you boil it all down, these cases show us that getting the right answer in medicine, it starts with asking the right question. Is this a crisis I need to solve now, or is this a condition I need to manage for the future? Just knowing which question to ask, that's half the battle. So it leaves me wondering, and maybe you too, what's the next right question you're gonna ask?